Welcome to Anatomy with Dr. Jasma. Today we're going to talk about the lateral femoral cutaneous nerve and neuralgia paresthetica. The nerve originates at L2, L3. There's some variation there. Some people it's L1, L2, but it's going to start out in that lumbar plexus and it's going to run just behind the psoas muscle. It's going to follow around the top of the pelvic brim and run through the fascia of the iliacus. So you have the iliacus muscle here, the hip flexor, then you have the fascia or the connective tissue that gives the iliacus its shape, and that lateral femoral cutaneous nerve is going to run through the fascia of that muscle. This bony prominence right here on the pelvis is called the anterior superior iliac spine, or the ASIS, and that nerve is going to run just below, somewhere in this region of the ASIS. So your inguinal ligament is going to run here to here, and it's going to run typically deep to the inguinal ligament. There are a lucky few that it actually runs through the inguinal ligament, much more likely to get compressed that way. This picture doesn't show it very well, but it actually branches from there, and we have an anterior branch and a posterior branch of the lateral femoral cutaneous nerve. It's purely sensory. It doesn't affect the muscles, but it does hurt when it gets compressed. The anterior branch is going to go to the front and lateral side of the thigh, all the way down to the knee. And then the posterior side is going to go to the lateral back side of the thigh and even into the posterior hip. And it's easily mistaken for IT band syndrome, but it's not IT band syndrome. But it does follow along the path of the IT band. When we're talking about an injury to the lateral femoral cutaneous nerve, this right here, this is the most common spot for that to happen. And if you think about what comes across here, well, our seatbelt comes across here. If we're construction workers, maybe even our tool belt comes across here. And if you can get a sudden hard compression or a prolonged compression on that nerve, that can lead to something called neuralgia paresthetica. And that's simply numbness and tingling and pain of the lateral thigh. It's also fairly common in pregnancy, but not so much from its compression around the ASIS, but rather its compression at the iliacus, the iliac fascia. As baby is sitting here and increasing weight and pressure on that area, that can tend to lead to pain and numbness and tingling down the side of the thigh. But your pelvic PT can help. We can do some techniques to help coax baby off of that side and be in a more neutral position, and prescribe external supports to help lift the belly up. And if you're dealing with that kind of pain, try this stretch at home. You're going to find a doorway, you're going to get into a lunging position so you want that painful side behind you. You're going to tuck your tailbone under. You should start to feel a stretch down the front side of your thigh, and then you're going to reach up and over, and we're going to do something called nerve flossing, where we go into the stretch and then off the stretch, and into the stretch and off the stretch, and you're going to repeat that several times. Do it several times a day, and that can start to help take pressure off of that nerve. If you're dealing with neuralgia paresthetica, go see your pelvic PT. They can help you right there. That's where you find one closest to you. And if you want to learn more about your body, hit that follow button.